Meet Thomas Boone and Zoe Grace, biological twins of Dennis Quaid. Thomas and Zoe were two of three patients at Cedars-Sinai Medical Center given a dosage of heparin that was 1,000 times larger than appropriate in the year 2007. As many as 98,000 people die annually from medical errors in hospitals. There are various types of sentinel events, from medication errors to wrong site surgeries. Although rare, these events have gained an increased focus due to their direct connection to government standards. JCAHO has developed a gold standard for healthcare organizations to follow, and using Lean Six Sigma tools, organizations can blend the standards into their existing healthcare environment. In 1996, the Joint Commission of Accreditation of Healthcare Organizations established a policy to investigate sentinel events defined as unexpected occurrences involving death or serious physical or psychological injury. Serious injury specifically includes loss of limb or function. Since the policy's inception, nearly 7,000 sentinel events have been reviewed. There are three types of surgical mistakes: wrong patient, wrong procedure, wrong body part. In 2009, the Rhode Island Hospital in Providence admitted to their fifth wrong site surgery in 2 years. A surgery was conducted on the wrong finger of a patient before staff noticed the mistake. Previous surgical site errors involved neuro and oral surgery cases. Product and device events include patient death or disability associated with the use or function of a device in patient care. In 2005, Guidant Corporation recalled 50,000 cardiac defibrillators and pacemakers because of malfunctioning. 21-year-old Joshua Ockrop died while on the bicycling trip when his implanted heart defibrillator short-circuited. Gerald Constantine died on October 8, 2010. After searching for 10 days, his family was finally notified of his death. Constantine had been seeking dialysis treatment at the Altabate Summit Medical Center. The hospital records indicated that he had been discharged instead of deceased. Family members looked for him, even filed a missing persons report before they were told the news. The abduction of a patient would be considered a criminal sentinel event. In 2007, a newborn went missing from Lubbock, Texas Covenant Lakeside Hospital when a woman wearing scrubs, posing as a medical worker, abducted a 3-day-old infant. The mother indicated the woman had been by the room several times before, requesting to take the baby for treatment. Care management events involve patient death or serious disability associated with medication errors such as wrong dose and wrong preparation. When Thomas and Zoe were given an overdose of heparin, Quaid expressed how his inherent trust in medical staff diminished at the thought of a mistake like an overdose to his twins occurring right under his nose because a nurse failed to look at the dosage. In recent history, the legislature has gotten involved in healthcare quality through the passages of many acts, including the Medicare Prescription Drug Improvement and Modernization Act, the Deficit Reduction Act, the Tax Relief and Healthcare Act, the Medicare Improvements for Patient and Providers Act, and the Patient Protection and Affordable Care Act. As of 2007, nearly half of the state's legislators had created regulations for hospitals to report sentinel events to the state governments. The goal of reporting were to both hold healthcare organizations accountable for mistakes and to learn about mistake prevention by disseminating information about best practices across the industry. The Joint Commission's policy on sentinel events aims to support positive experience in every patient's care, help organizations learn from their own mistakes and implement preventative measures against recurrences, help all healthcare organizations learn from mistakes made elsewhere, and to validate quality healthcare with accreditation and Gold Seal approval awards. Quality check is one way that healthcare organizations can now be held accountable. It was established by the Joint Commission and is a way to check for the Gold Seal of approval and accreditation for healthcare organizations. Their mission is helping healthcare organizations help patients. If a sentinel event occurs, the organization is compelled to conduct a detailed root cause analysis, developing an action plan and monitor the plan in order to determine if the improvements are appropriate. And healthcare organizations may choose whether or not to notify the Joint Commission themselves. There are advantages and protections available to organizations who report sentinel events, as well as penalties for those who do not. In the year 2000, a book entitled To Err is Human was published, intending to be the first in a series of publications regarding the quality of healthcare in America. A congressional record from the Senate in 2000 stated that more than 250 people die of medical errors, the equivalent of a major airplane crash every day. The consulting company, Studer Group, aids organizations in targeting areas of service, quality, employee improvement, finance, and growth. The group's founder, Quint Studer, was once an administrator himself and understands the obstacles faced by the organizations. In healthcare, he focuses on making the service purposeful and worthwhile, remembering that the patient is the customer. Healthcare organizations can learn from their mistakes by implementing the problem-solving process. The first step of the process is to identify the problem. Next, analyze the problem, generalize potential solutions, select and plan a solution, implement the solution, and finally to evaluate the solution. DMAIC stands for Define, Measure, Analyze, Improve, and Control. The DMAIC model is one of the ways healthcare organizations are exploring the use of Lean Six Sigma tools to improve their healthcare systems. Healthcare organizations usually measure their performance using metrics such as service level, service costs, clinical excellence, and patient satisfaction. Healthcare organizations use many Six Sigma tools for their statistical analysis of their performance measure to ensure sustainability quality healthcare. Useful tools include regression analysis, Pareto charts, and quality function deployment charts. The Thibodeau Regional Medical Center continues to be ranked in the top 1% of patient satisfaction. The hospital started by using satisfaction surveys, report cards, and interviews to better understand its customers. It has completed several Six Sigma projects, resulting in patient satisfaction, cost saving, and in quality improvement initiatives. Because of the twins' personal history with medical mistakes, Quaid has become passionate about healthcare quality in America. But what is this quality healthcare we should be striving for? The Agency for Healthcare Research and Quality has coined the following definition for quality healthcare: doing the right thing, at the right time, for the right person, and having the best possible result.